Hi, Avon. I'm Fire Chief Bob Spur coming to you with one of our COVID-19 updates. Joining me as always is,
Kathleen Waldron, health agent for Avon.
hi, Kathleen. Let's start with the numbers real quick. Yesterday we had just under 6.9 million cases in the United States, with, by the data I use, 193,900 fatalities. The news is reporting 200,000. Part of that's data sources vary by a little bit, but there's around 200,000 fatalities. In Massachusetts, we're 126,408 cases with 9,135 fatalities. And that's actually a probably more accurate number. It's one data source we use. Kathleen, how's Avon?
Sure, locally we have 85 positive cases. We have seen a small bump in the numbers since the last time we had a video. And I'm going to ask Chief Spur to explain the new color scheme that Massachusetts has out. I think we briefly talked about it, but if you could explain how it will affect Avon.
Sure. So I'm going to share my screen here and we'll look at it there. Just give me a second. Massachusetts has gone to a color criteria system, and they run four colors: gray, green, yellow, and red. And what they're measuring is the average daily incidence rate per 100,000. We look at everything per 100,000 over the last 14 days. A gray community is one that's got less than 5 reported cases in that time frame. A green community is a community with an incidence rate, so a case rate per 100,000 on average, of less than 4. Yellow is between 4 and 8 incident rate, and a red is above 8 per. But something to keep in mind on that, and important in Avon, is this next slide, is how the size of your community has to be. Small communities run into a situation where they potentially cannot be green, maybe cannot be yellow. Avon's one of those. How this numbers work: gray communities are communities with under 5 cases, and they only report a community as under 5 cases if you're less than 50,000. Really kind of an esoteric thing, not something we need to get into. A green community, to be able to be green 5 cases, you have to have at least 9,000 of population. If you don't have 9,000, 5 cases will put you into the next level automatically. You'll never show up as green on the map. A yellow community has to have 4,500. We just missed that. We're at, I think the state calls us 4,430 is the number they're using. So a yellow community, we can't qualify there either. 5 cases is an 8.1 for us, just by the way the math works. What that means is Avon is only possible to ever be gray or red. There's no in between. And a good example of that's a community of West Hampton. 2 weeks ago, West Hampton was red with a very high number. They were 12 to 14, somewhere in that range, maybe higher than that. They only have a population of 1,700. Their cases were 5. So they hit the absolute minimum, but they triggered a significant red. West Hampton had been 0, 0, less than 5, 5, which triggered red, less than 5, 0, 0. It was a very short-term bump to get over that. They went from gray, red, gray. We could very easily be in that same situation. Especially Kathleen, I'll let you talk over this. We're at 3 now. So, 3 new ones. We're at a point where 2 cases between now and October 2nd, I think it is, would put us red. Let me come back to the stop the share for a second. One thing about that, people think, oh my goodness, from a school standpoint, what do we do there? And DESE, as part of another thing they're doing with schools that are gray and green, wanting them back in a hybrid model at least, they've said that we need to look at a 3-week red average. So if a 1-week red isn't a huge deal to them, a 2-week, something's going on, we need to pay attention to it. It's not till we get 3 weeks that they're going to be talking to the school district and going, we need to evaluate what's going on. Where I'm going with this, folks, if you see us turn red, you're watching the TV and, hey, Avon's on the list, don't freak out.
Yeah.
Please don't freak out. Red in Avon could mean 5 people. So we don't want any cases, but it's not oh my goodness, it's not dozens and dozens like some of these other communities would have to get to. I mean,
And I
Kathleen,
think
I
that,
think that's what you're feeling.
yeah, that's why I want you to explain it to the residents,
Yeah.
because I don't want to put people in a panic, but I want people to be knowledgeable of the numbers, what they mean, and specifically for our community, because we are so small, how it will affect us.
Right. I'm going to jump on a couple other things here. I want to go through a couple things in the slide deck. Um, this is the current communities in the state and where they lie. And if you look at Little Avon down here in the middle, right there, if you look at the communities around us, most of them are yellow. Randolph is green. Randolph's doing awesome. They're not only green, they're a low green. But the communities people from around us come into Avon from overall are doing really well. Even Brockton's is simply a mid yellow. Brockton's actually really gone on the right path here, and things are good there. So the places that kids from schools come into our school system, people come in to shop. They're from fairly safe communities, low risk communities that are coming in. We're not surrounded by reds at all. We have the highest potential, honestly, to be the red island in the middle of it, strictly based on population size and no other reason. So if we look at what is this doing in Avon? Well, let me clear my annotation. There we go. What is this doing number-wise? This looks at our growth rate per 100,000, and this is from a couple different sources. The gold, red, and green are from the state weekly data summary that is freely available to anybody. Actually, no, this is the daily one. So this is the daily dashboard. Anybody can get it at mass.gov/COVID, and you can find it. The Avon numbers are what we talk about. And then that blue line is the federal number, the national numbers. And we've chosen to use the Atlantic website. It seems to be the best. It's sourced from the states rather than being sourced directly from the federal government. We simply didn't want to get into whatever was going on with the Fed, and the states have seemed to be a very good data source. So that's what we've chosen to use, primarily for consistency. We've had a rise since July 1st. There's definitely an increase per 100,000 in state, our county, our adjoining county, and Avon at the moment is bumped up. And the national numbers have just started to go up again. It's only happened in the short term, so we don't know if that's a trend. It could just be a blip in the data. We're not sure. I think, Kathleen, what we wanted to talk about, though, was to say, look, the numbers are on a rise. The weather's getting cooler. The hospitals are telling us they're seeing more COVID patients again. It's not, oh my goodness, we're back in late April where you see how high the numbers were. We're nowhere near that, but people need to be vigilant. So that's important. And this is fatalities. You can look at the fatalities have simply remained level, which is a nice thing. We've leveled off and they figured out what, some better treatments, and a lot of the really sick people early on have gone through the system. And now we're at a fairly steady fatality rate in all the sectors. This is the last one I want to look at. This is cases per 100,000 by population age. And this is available on the weekly summary from Massachusetts. Anybody can get these numbers. Early on, this was definitely a case, an issue for older folks, especially that 80 range. And you can see the black line on the top. It still is. The things I think are important to point out here is there's a band in the middle where all those lines are together, and that's the age range from 20 to 79. The incidents of catching it are almost identical, basically, in the middle. And then the 19 and under population is the purple at the bottom. But something to be cognizant of, that purple line and the dark blue line above it, so the range from 0 to 29 years old, they're the highest increase at the moment. That's where the new cases really seem. Other ages are getting it, no question about it. But it's the younger ones that are really, we're seeing more cases in. So kids can get it, 20-somethings can get it. And that purple line, the kids, That goes up to 19. So that a lot of it could be 18 and 19-year-olds away to college. I'm not saying that's a bunch of 5-year-olds. We don't know. We don't have the state actual age breakdown. But it is increasing some in the child population. The good thing about that, the fatality numbers, especially in that age range, are on the floor. They're really low numbers. That doesn't mean they don't get sick. You know, it's altogether possible to survive this and have lasting damage, especially the older you get. So you still need to be very safe around it. So that was my little COVID educational thing today. Kathleen, what else do we want to talk about? I know you had a list of things.
Yeah, there's a couple changes that will be effective beginning Monday, September 28th. So I'll briefly go over those. One of them is in restaurants, party sizes can be 10 now instead of 6. They are allowing for bar seating. However, either there needs to be no bartender behind the bar, or there needs to be some kind of barrier, such as a plexiglass barrier between the patron and the bartender. And bar seats do need to be 6 feet apart in between parties. So if I went by myself, the next person would have to be 6 feet away from me. If I went with one other person, it'd have to be 6 feet from each person, but we could be together, if that makes sense. One of the other things is in retail stores, such as Cumberland Farms. I know we don't have one, but if you're visiting one, they are allowing for self-serve of coffee now. There are some guidelines that need to be followed, but that will be allowed again as of Monday. I think that was it for the changes, the big changes anyway. Just other things I wanted to briefly touch base on is there is still COVID testing clinics in Randolph every Wednesday and Saturday. So if you have been a close contact, if you have symptoms, you're more than welcome to call and schedule an appointment, or they do have walk-in availability. If you need more information, you can find it on their website, or you can contact me. And then I'm also working on setting up a flu clinic for the town of Avon, and that will be on October 14th. It's going to be different this year, like everything else going on, but it'll be an outdoor event where you line up in your car. It'll be at St. Michael's. You'll get out of your car to be vaccinated, and then you'll get back in your car and head on your way. We also have the opportunity to join with Randolph and potentially Holbrook to offer some flu clinics in those towns, but it gives residents of Avon more availability to get their flu vaccine. One other thing too, I know Halloween is coming up and people have been talking about what's going to happen. There's still no word from the state of Massachusetts. But I have been told that they were looking at the CDC guidance, which is available online. So I don't have an answer yet. I will let you know when they do decide. But I just wanted to let you know that the CDC guidance, if you wanted to take a look at it, is on the website.
Excellent. Two things. So the flu clinic on the 14th, people might, it's different because it's drive-through. And you might see us doing a couple little things you wouldn't expect. Lottery, raffle tickets. That's us. So we're using the flu clinic to test our emergency dispensing site plan in that. Emergency dispensing site is a multi-hazard vaccination or dispensing plan, which may or may not be used for a larger vaccination effort when something comes out for this. So one of the things we use little raffle tickets as a tracking device to go through, purely to kind of vet out a computer thing we're working on in-house to track it. So it's a regular flu vaccine. This isn't something different. We're just trying a couple little experimental paper things so that we know how many people we've seen and stuff like that. But if you come in and go, why are they doing this? It's because it's Bob Spur and Kathleen Waldron. How we can track stuff is pretty much what it is. So nothing different there. The other one, town hall status, facility status we talked about. Town hall is open full, normal, regular hours by appointment only. So still no walk-in. However, those hours you were used to people being here, give a call. You should be able to get an appointment during that time frame. They might not do hours that first half hour of opening so that they can get up and going. I'm not sure. Give a call. You need to talk to someone, give a call. We really want to do the best to accommodate getting people in and serving the citizens of what needs to get done.
With that said, though, sorry to interrupt, but if
Sure.
you do call, leave a message with somebody. It's not like we have cell phones and we don't see the number and call back. So if you leave a message, I know someone will get back to you. But if you just keep calling, you may not ever get anybody.
Yeah. Library is open by appointment in half-hour blocks for a limited number of people. So call over the library. You can get in there with up to 5 people. I think if you're a family of 6, they might, with little kids, they might be able to do something for you, but it's 5 is the official number. Give a call, talk to them. They'll set you up with a block. They have availability. So please go see the library. Council on Aging is really no different than it's been for a while now. You need something to do with the Council on Aging, any questions, concerns, whatever, call. They will figure out a time to help you out, in a way to get with you. Council on Aging is really being as accommodating as possible to serve that senior population. So that's kind of the town status on that. Anything else we didn't talk about? We went for a long time on this one.
I was going to say, I think this one was a little longer than what you're used to. But again, we want you guys to be informed and know what's going on in our community. We don't want to scare you. We just want you to be aware and cognizant and socially distant and wear your mask.
Exactly. You know what? That's great advice. And let's end right there. Folks, we'll see you next time. We got something to tell you. Goodbye.